Skin creams don't fix musculoskeletal problems. Don't be sold on the wrong treatment for lots of money. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I want to talk to you about pain creams, gels, and oils today. You probably know someone that would benefit from this, so feel free to share this video with them, okay? Over recent years, I'm seeing more and more advertising on TV around magical, pain-relieving gels and oils and creams. And I've seen them with spokespersons as big as Shaquille O'Neal, not only in personality but stature, right? And lots of other celebrities. I've seen the amazing healing powers of CBD creams advertised as well. This is the newest bandwagon, so it makes sense that we'll see lots of this CBD oils and creams in the coming years. Now, before I get started, I want to be clear here. All of these creams and oils and gels are going to have some pros and cons. Some probably absolutely help with some temporary relief. Maybe they work like kind of like a TENS electrical unit, and they sort of draw your attention away from the pain or the source of the pain for a little while it's on. And maybe they actually do penetrate deep and offer some sort of pain relief that way. I don't know. I'll never say that these things don't provide some relief on some level. That would be an ignorant statement on my part, and I try to be smart. So I'm not going to make that claim. But what I will say is that creams and gels and oils, they will not by themselves fix musculoskeletal issues. We have used products like BioFreeze for years in our clinic, and patients absolutely love it. But no bottle of BioFreeze ever did what a chiropractic adjustment or a great targeted exercise can do for pain. Instead of spending money on tubes and tubes of gels and creams every month, taking a good brisk walk around the block once a day and visiting a manual therapy provider when needed can typically do the trick and be exactly what you need. Now, what makes a patient just want to buy creams and gels rather than get treatment for a long-standing pain? Well, there are a few reasons other than just sheer convenience that come to mind. Number one would be expense. Two, fear of the unknown. And then you've got number three, the lack of trust. Number four, previous bad experiences. Number five, they don't think feeling better is even possible. And number six, they don't want to be told to exercise. And then the last one is that pain defines some people. Now, I'm sure there are more reasons, but these are just the ones that come to mind immediately. So let's discuss them each briefly. Let's start with expense, the cost of being treated. Well, here at Creekstone Integrated Medical, yes, we have a chiropractor that's been voted best chiropractor in Amarillo several times, but we also have medical services, massage, exercise, and strengthening, and we also have acupuncture. So the cost of treatment would really depend on which service one chooses. Many patients require more than one service. Now, according to the American College of Physicians, a broad management, several services combined, is what gets pain knocked out. So some patients may opt to try to keep costs low by limiting treatment to chiropractic only, or trigger point injections only, or massage and acupuncture, and doing their exercises at home instead of here at the clinic so that they can save themselves some money. But whatever your treatment looks like, we are sensitive to financial concerns, and we're happy to help you the best that we can inside what you're comfortable with. It's that simple. Now, the next one is fear of the unknown. Well, the first thing to understand is that you can come and just meet us and all of the other providers and our staff, and we'll give you a tour of our clinic at no charge. We're proud of our clinic. We can't wait to show it off. You can have a free initial consultation with our providers just to meet them and get to know them a little bit. Meeting a provider and touring the clinic can typically take some of the fear of the unknown out of the conversation completely. The next one is lack of trust. Sometimes you've been told bad things about specific providers or a specific entire profession, and this can lead to a lack of credibility or trust. Now, let me assure you that, first of all, I am all about evidence-based, patient-centered care. Research papers, everything is based in national guidelines. We're not making stuff up, and we're not trying to drag people through here a million times, and all of our providers have that mindset. I also want to assure you that our providers went through years and years of specialized study to be able to help you at a high level. Our nurse practitioner had to spend several years as a nurse, as an RN, and then a BSN, and then finally, after years of study, he achieved his nurse practitioner certification and is able to now treat patients on his own with medical director oversight. For the chiropractic part of Creekstone, I am the only fellowship-trained chiropractor in Texas west of the I-35 corridor, all the way down to Mexico. That's a lot of land, folks. In a profession where only 2% get fellowship training, at this point I now have 2 fellowships, one in orthopedics and one in forensics, which means I'm an expert witness for court cases when called upon. And that should build some trust, I think. I also host a weekly research-based podcast, and I've authored a book called The Remarkable Truth About Chiropractic, a unique journey into the research, which is available on Amazon. Again, hopefully all building a little bit of trust in Creekstone. On top of all of that, our acupuncturist went to school for approximately 6 years to get licensed, and our massage therapists are all experienced and licensed as well. Next, a previous bad experience. Well, we cannot turn our patients into raving fans by taking advantage of them, or scaring them into treatment, or giving them a bad experience. That's not how you make fans. While we are in the healthcare business, we are also very aware that we are also in the customer service business. And we absolutely love taking bad experiences from other providers and turning them into wonderful healing experiences here at Creekstone. In addition, just because physical therapy, medicine, or chiropractic, or whatever didn't help you in the past, well, it doesn't mean that they can't help you currently. Sometimes you just need a different provider whose skills match your issue better. That's it. Just a change of scenery sometimes can make all the difference. The next one is, you don't think feeling better is even possible. Well, this is the key to chronic pain staying in place. However, understanding that it will be a journey, but that you can move and function and climb out of the chronic pain pit, that's the first step to actually and finally feeling better. Feeling less pain is absolutely possible, no matter how long you've been hurting. You just need a place like Creekstone that specializes in chronic pain. In fact, I teach courses to fellow chiropractors on chronic pain treatment. Feeling better and playing a bigger role in your life is absolutely within reach, so you got to get rid of that thought immediately. Next, you don't want to have to exercise. Well, a sedentary lifestyle leads to increased anxiety, increased depression, and less sleep, not to mention all of the other bad health problems associated with little to no activity. All of it serves to deepen chronic pain, make it worse. However, on the other hand, just taking a simple daily walk can reverse things, profoundly even. Movement is healing. Motion is the lotion for our joints. Patients that have just undergone serious surgery, including joint replacement, are still up and walking the hospital halls almost immediately, because motion and activity helps you heal faster and more thoroughly. Don't be afraid of movement. Hurt does not mean harm, so you should embrace it. Embrace the movement. There are no hacks or shortcuts here. You just got to embrace it. Another one, pain defines you. This is the last one we'll talk about. Pain defines you. Well, this one can be a bit touchy to talk about, but let's be honest. We all know someone, maybe you, whose pain has come to define them, and they talk about their pain to anyone who will listen. They think about their pain all of the time and their misery. They take a bath in their misery. They plan their day around their pain. They embrace their pain like a warm blanket. They want everyone to know how they suffer, and sympathy for their pain really doesn't hurt their feelings much. They welcome the sympathy. These patients are in no hurry to do exercises. They're in no hurry to go for a walk or even seek treatment in the first place. If they don't have their pain to cling to, what will they do? Now, this is a behavioral issue, of course, but this type of stinking thinking can seriously limit a patient's life and enjoyment of that life. We've only got one life to live, folks, so isn't it better to hurt but get the work in resolving, at least to the best of your ability? A sedentary lifestyle is not an option. And while moving may hurt, if those that are in chronic pain, if they wait until they quit hurting before they start moving, well, they're in a lot of trouble because they're not going to quit hurting. Now that I've covered the reasons that patients buy skin creams for deeper musculoskeletal conditions, let's say this. The creams and gels can reasonably be used as an ancillary treatment choice for muscle pains. They may be effective, and at the end of the day, if it makes you feel better, who cares how it works? Even if it's a placebo effect, it doesn't matter. The result is that you feel better, and that's what it's all about. But using creams is like taking the battery out of the smoke alarm because you don't like the racket. Well, the fire's still going. The relief is typically short-lived because creams and gels, they'll never solve the source of the underlying issue, the deeper problem that is causing the alarm bells. The American College of Physicians does not recommend oils, creams, and gels as first-line therapies for back pain. Instead, they recommend spinal manipulative therapy, exercise, massage, acupuncture, low-level laser, and low-grade meds, all of which we have right here at Creekstone Integrated Medical under one roof. So stop putting up with pain. It's no longer welcome in your house. Take all of that money that you would spend on creams and gels and oils every month and maybe reduce that to where you use it as an additional ancillary supplement to treatment, but for the most part, kick it to the curb. Let us help you. Call Creekstone Integrated Medical at 806-355-3000. Let's get you on our schedule and on the road to getting active, living a better quality of life, and enjoying your time with your family and friends. That's huge for so many in our community that have been dealing with severe pain for years. We can do something to help this. Again, I'm Dr. Jeff Williams. Give us a holler. Be safe. We'll see you next week.